Peace, love, and blessings, everyone. It's your girl, Zia the Begum, back at again with another episode. This is episode 11, and today we're talking about something that often gets overlooked in conversations about equity and health justice, which is correctional health. Now, when we think about healthcare, we usually picture hospitals, clinics, or community programs. But there's a whole population that lives in the shadows of the system. People who are incarcerated. And here's the truth. Correctional health is public health, and public health is community health. What happens behind bars never stays behind bars. Most of the information I draw from is the CDC Correctional Health page. The article Correctional Health is Public Health, is Community Health, a collaboration is essential, and also an opinion piece from the New York Times. Correctional health covers all aspects of well-being for people who are justice system involved. That means from the point of arrest, through detention or prison, and even after release when they re-enter their communities. It's not just about incarcerated people. It also includes their families, the staff who work in the facilities, and the broader community. Think about it. Staff go home after their shifts. Incarcerated people may eventually come home, and untreated illnesses or trauma don't disappear at the prison gates. The CDC emphasizes that incarcerated people face higher risk of HIV, hepatitis, sexual transmitted infections, tuberculosis, traumatic brain injuries, and chronic health conditions than the general population. Add to that unstable housing, substance use, and mental health disorders, and you get a population that desperately needs care, but often gets the least. Let's talk about numbers. Incarcerated people are 3 times more likely to be living with HIV compared to the general population. Rates of hepatitis C are 10 times higher in correctional facilities. Tuberculosis occurs at rate 6 times higher than in the general population, and nearly half of all incarcerated people report a history of traumatic brain injury, something linked to depression, anger, substance abuse, and suicide risk. And let's not forget women. Pregnant women in the prisons still report being shackled during labor in some states, facing inequity prenatal care, and often lacking even basic hygiene supplies. These aren't minor oversights. These are life or death disparities. Now, we can't talk about correctional health without talking about race. Black Americans make up about 13% of the U.S. population, but they account for 40% of people incarcerated. That's 5 times the rate of white non-Hispanics. This overrepresentation of Black, Indigenous, and people of color means correctional health is a racial justice issue. These communities already face higher rates of chronic disease, less access to health care, and socioeconomic barriers. Incarceration just pours gasoline on the fire. COVID-19 outbreaks in prisons didn't just impact incarcerated people. They spread to staff, families, and communities. At the time when this article was published, the New York Times opinion, which was the coronavirus crisis inside prisons won't stay behind bars. It was during the pandemic. I believe it was published June 2020. So some of this is a little bit old. This information is like 5 years old. The nation's top 5 COVID-19 hotspots are all correctional facilities. According to the data collected by the Times, the number of infected inmates and workers has topped 70,000. The count doubled between mid-May and mid-June, and there have been at least 627 virus-related deaths. Even these infection numbers are assumed to be an undercount since testing for the virus remains inaccurate and uneven. New York State has tested only about 3% of its 40,000 inmates, and more than 40% of those tested were confirmed infected. In Mississippi, Alabama, and Illinois, fewer than 2.5% of state prison inmates have been checked. Some states like Texas have moved to ramp up testing, and their reported cases are soaring. Further complicating the count, some facilities do not make their testing numbers public. Inmates are scared and desperate, and tensions occasionally boil over. In April, more than 100 inmates at a prison in Washington state protested after 6 inmates tested positive for the virus, and a smaller uprising occurred at a Kansas facility after more than 24 inmates and staffers tested positive. Again, this piece was from the New York Times. You can read more there. And again, the article was "The Coronavirus Crisis Inside Prisons Won't Stay Behind Bars." Back to the episode. I'm not saying every inmate comes home, of course. You have people serving life sentences, or unfortunately, they end up dying before they can be released. But let's think for a second. Let's think about the inmates that do get released. When they return, they often face untreated illnesses, unmanaged mental health conditions, and very little support. Imagine coming home with HIV, hepatitis C, or untreated diabetes, but no insurance, no stable housing, and no job. That's why transitional care or continuity of care is so critical. Planning for health becomes someone is relief, connecting them with clinics, mental health services, housing, and employment support. Studies show that when incarcerated people have a warm transition back into care, meaning someone literally bridges them to a clinic or a case manager, outcomes improve. Recidivism drops and the community as a whole benefits. It is imperative to remember that public safety is public health, and public health is public safety. So what needs to change? More accountability for prison healthcare contractors, better collaboration between correctional health and community health centers, culturally competent trauma-informed care, and investment in re-entry programs, because ignoring health during incarceration only guarantees higher costs, more illnesses, and broken families afterward. The truth is, correctional health isn't separate from our community. Incarcerated people are just temporarily displaced community members. Their health is our health. So as we close out today's episode, remember this: healthcare is a human right. Ignoring the health of people behind bars isn't just an injustice to them, it's an injustice to all of us. Correctional health is public health, and public health is community health. It's your girl, Zia the Begum, and the mic is on.
Zia the Begum, here to stay. In her softness, she paves the way.